Unfortunately, this morning we do have one change to the programme. The Secretary of State for Health for England is unable to join us today, either in person or by video link. This is because, and I just need to get this right, he had to clear his diary to ensure he can fight for the NHS in the spending review, or be anywhere else you may have seen or heard him this morning. As I said before, we didn't start the fire.
We unwittingly find ourselves at the centre of a public storm over face-to-face appointments. The malicious criticism of the profession by certain sections of the media and by some politicians as a result of the shift towards remote working, introduced to keep our patients and our teams safe and keep the service operating, has been the worst that I can remember in over 30 years as a GP. This widespread vilification of hard-working GPs and our teams is unfair, it's demoralising, and it's indefensible. No one working in general practice deserves this abuse, and your college will continue to fight on your behalf until we get the support we need to provide the best possible care without risking the safety of our patients or jeopardising the health of our teams. The so-called support package for general practice in England, announced this morning, is most definitely not the answer to the challenges that we face in providing high-quality care for our patients. Calling today's announcement a missed opportunity would be the understatement of the century. But we'll only really be able to engage with and effectively lead these trends if we're successful in addressing the biggest challenge to general practice, undoable workload. And that's why addressing workload is our top priority as a college, and also why I'm so disappointed with today's government announcement in England. We're working in a number of areas to address these long-standing challenges, the most important of which is lobbying for a larger workforce. We've successfully lobbied for more training places, and as a result of our campaign in schools and medical schools, general practice is now a highly attractive career option. Working with our governments on specific programmes to improve retention, and we're starting to see a significant increase in the number of pharmacists, link workers and mental health professionals working in practices. But growing the workforce is a medium or longer-term solution, and the problem is now. So we're working with our BMA colleagues to reduce unnecessary administrative work, which takes us away from caring for patients. We want a lighter touch, high-trust approach to contract management, more proportionate regulation. We want to allow other health professionals to sign return-to-work certificates and to have limited rights to prescribe.